Good morning. I think we're going to start with Marion today, and then I'll give my update.
Thank you, Dr. Morrison. Good morning, everyone. The vaccine rollout on P.E.I. continues to go smoothly, and I know as healthcare workers are getting their COVID vaccines, we're encouraging all those who receive a call to get theirs, to come to their appointment and continue our efforts to protect yourselves, our patients, our residents, and families. I also want to further acknowledge the enormous effort that's been ongoing over the past number of months and weeks with testing thousands of people across the island for COVID-19. Our COVID-19 drop-in testing site hours will be modified over the holidays, giving a much-earned and well-deserved minimal break to our testing clinic and laboratory staff. If you require routine tests that would normally occur on December 24th, 25th, December 31st, or January 1st, please plan ahead to be tested and check the testing website for availability, as some clinics are closed or will have limited hours. All testing clinics, Lemon Park, Park Street, O'Leary, Montague, will be closed on December 25th and January 1st. If you require testing when the drop-in testing sites are closed over the holidays, please call 811 to arrange for a test. Walk-in clinics will be available over the holidays, and I encourage Islanders to visit the walk-in clinic website to see availability, and all services will resume their regular hours on January 4th. Our cough and fever clinics will continue to be operating for anyone with respiratory symptoms needing assessment and care. Please as well refer to the website for the holiday hours for these clinics. Thank you to everyone who's been part of this COVID response to date, including Islanders, who are protecting each other and limiting the spread of the virus by following our public health guidance. With Christmas just around the corner and New Year beginning, it's time for us to be grateful for each other and to be proud of the collective efforts over this past year. It's time to turn the page on 2020 and look forward to a positive year in 2021. I hope Islanders all have the ability to spend some quality time with a small group of friends and family this season, doing the activities you enjoy. I'm wishing everyone a happy and safe holiday season. Thank you.
Thank you, Marion. I think it is a natural time of reflection as we look forward to this holiday season and as we come to the end of the year. This time last year, certainly a global pandemic wasn't really on the radar. And a year later, we actually have much to be grateful for as we look back at all that we have accomplished and put in place in our province during this global pandemic. I think we can reflect on the ways we've been able to help each other and help us get through these challenging times, the ways we have adapted and coped with resilience and compassion. Today, we should be proud of where we are. COVID-19 has impacted all of us in this province as a population and as individuals. And while this Christmas and holiday season might not be the holiday that we expected or planned for, I am optimistic by this time next year, we will be in a very different place. There are no new cases of COVID to report today in P.E.I. We have 7 active cases that are all self-isolating at home and are being followed daily by public health. Since the pandemic began, we've had 91 cases of COVID-19. Globally, the impact of COVID-19 is staggering, with almost 76 million cases and 1.7 million deaths. The United States has reported almost 18 million cases and 320,000 deaths. The U.S. accounts for 23% of the cases worldwide. In Canada, there's been over 515,000 cases and 14,300 deaths associated with COVID-19. So the situation in our own country remains concerning, with cases continuing to be on the upswing. It took Canada 6 months to record our first 100,000 cases of COVID-19. And sadly, the last 100,000 cases were diagnosed in just over 15 days. While most provinces experienced a small decline in the cases in the last week. There were a total of 46,000 new cases last week, with an average of 6,578 cases per day. Across Canada in the last week, there were 776 deaths. Hospitalizations were up 11%, and ICU admissions were up 18%. With over 3,000 people per day in hospital with COVID-19, health systems across the country are strained. Healthcare workers and professional associations in some provinces are issuing dire warnings that the current demands for acute and intensive care are not sustainable. The rising case counts are of particular concern to our province, given we are susceptible to importation of COVID-19. 87% of our total cases are related to travel. We can be grateful that in P.E.I. to date, we've not had any hospitalizations or deaths related to this virus. Much has been reported in the last few days about the mutations and variants of COVID-19 that have been identified in other countries. It is a normal phenomenon for viruses to mutate, so these changes are not unexpected. At this point, there's no reason for people to be alarmed about these mutations, but it does remain a concern. There is no indication that the mutations will impact the effectiveness of the vaccine or the current public health measures at this point. Staff in our office are involved in regular discussions with colleagues and experts across the country and internationally to keep abreast of the latest information. And I will certainly keep Islanders informed of any of that new information as it becomes available. Last week, P.E.I. received the first shipment of 1,950 doses of the COVID-19 vaccine. And by the end of today, approximately 1,500 Islanders will have received their first dose of the COVID-19 vaccine. And the remaining individuals will receive the vaccine next week. Knowing there is a safe vaccine available for COVID-19 is very exciting for our province. It signals hope, and it is a sign there may be an end to this pandemic. As I've said previously, there will be vaccine for all Islanders who want to receive it. Although it will take months for everyone to be vaccinated, Islanders can be assured their turn will come. P.E.I. will receive regular shipments of the Pfizer vaccine in the coming months. Once approved, we expect to receive regular monthly shipments of the Moderna vaccine in early 2021. Similar to the Pfizer vaccine, the Moderna product is also a 2-dose regimen. P.E.I. will continue to administer the initial doses of COVID-19 vaccine to Islanders based on recommendation from the National Advisory Committee on Immunization. And the 4 groups that will be planning to be done in the first quarter are residents and staff in congregate living settings that provide care for seniors, such as long-term care and community care. Adults 70 years of age and older, beginning with adults who are 80 years of age and older, healthcare workers, and adults in Indigenous communities. Last week, the first doses of the vaccine were administered to healthcare workers involved in the COVID-19 response and long-term care staff who provide direct patient care. Our plan is to begin administering the vaccine to residents in long-term care facilities in early 2021. If anyone has questions about the vaccine, please visit the provincial COVID-19 website, and it's Prince Edward Island /COVID vaccine, and that's going to be updated regularly with more questions and answers available on that site. Last week, I spoke about how important self-isolation is in breaking the chain of transmission of COVID-19. And while most individuals want to do the right thing and follow the self-isolation rules, there continue to be some people who believe these rules do not apply to them. I plead with anyone traveling to P.E.I. over the holidays or returning from travel to adhere to the self-isolation rules. No one wants to be responsible for transmitting COVID-19 to their loved ones. And the only way you can eliminate that risk of transmitting COVID-19 to others is to self-isolate. For family members who travel to P.E.I. for the holidays, the preferred option is to self-isolate in a separate location for 14 days. And when in self-isolation, you are required to stay on your property, leaving only to seek medical care. Everyone in self-isolation should have identified a support person to drop off food, medicine, and other essential items. There are situations when individuals travel to P.E.I. and decide to self-isolate with their P.E.I. family. In these instances, it is important that all members of the family agree to self-isolate for a full 14 days. Currently, there are 900 households in self-isolation in P.E.I. In addition to the daily check-in calls through Operation Isolation, we are increasing our enforcement efforts for people in self-isolation, including random checks. We want to be sure that people who are supposed to be self-isolating are in fact doing so. Over the past few days, 55 random checks were completed on people who were in self-isolation. There were no issues in 52 of these situations. The remaining 3 situations remain under investigation, and it is too early to confirm if anyone will be charged. The early results of this work confirm that most people do follow the rules and self-isolate properly. We've also increased our proactive enforcement in retail outlets and restaurants. Over the weekend, 32 businesses were inspected to ensure they were adhering to the current public health measures, including capacity restrictions. 26 of these establishments were fully compliant. The remaining 6 businesses will receive a follow-up visit soon to ensure the identified concerns are corrected. Most of these issues relate to operators not being aware of how many people were in their spaces. The inspectors helped the operators to determine the capacity for their space and recommended that individuals be assigned to monitor how many people are entering and leaving the establishment. We greatly appreciate the additional support from staff in our office and our enforcement partners. Thank you for being willing to go the extra mile and support our collective efforts to keep Islanders safe. It has been upsetting to hear that on occasion the border screening and enforcement staff have been subjected to very unkind remarks and gestures from individuals. Despite having to manage these tough situations, thank you for your continued commitment to keep Islanders safe. And despite our increased enforcement efforts, I am worried about what may be coming our way in the months ahead. And as I noted last week, my worry relates to 3 areas: the rising case counts and numbers of active cases in the rest of Canada, the increased amount of holiday travel to P.E.I., including family members arriving from COVID-19 hotspots, and the holiday season is a time when we are more likely to let our guard down and connect closely with people, thereby increasing the risk of transmission. I will note that as we have done all along, we hope that we are able to ease up even further in terms of public health restrictions in the next few weeks. We know the Christmas and holiday season will be different for most families this year, with smaller gatherings focused on household members, plus up to 10 other individuals. The individuals that households associate with should be as consistent as possible, and physical distancing should be maintained as much as possible. Associating with consistent people means you should keep your list of close contacts outside your household to really no more than 10 people. It does not mean you can associate with 10 people on Christmas Day, 10 different people on Boxing Day, and yet another group of 10 different people on New Year's Day. Outside of your household contacts, really try to keep your list of close contacts small and aim for 10 people. Islanders should not host or attend large holiday gatherings. Think small, think consistent, think cautious. The holidays are different just for this year and not forever. I hope the holiday season in 2021 can be more normal for everyone. If anyone develops symptoms of COVID-19 over the holidays, they should self-isolate and arrange to be tested. And they should self-isolate until their test results are back. If you have any symptoms of COVID-19, please do not put off getting tested just because it is the holiday season. While the holidays are a joyful and fun occasion for many people, it is a lonely and sad time for others. If you know someone who is lonely, depressed, or anxious, please reach out to them. The smallest gesture can be very meaningful to someone who is feeling alone. And if you are struggling with mental health issues, please visit the provincial website for a list of online and phone supports. And if you need to talk to someone right away, please call the Island Helpline. Our plan is not to have regular Tuesday press briefing next week. If our COVID-19 situation changes and there is information to share, certainly I'll be available, and I know the same would be for Marion. But given that this may be, and I actually hope will be, the last briefing of 2020, I'd like to thank some of our many unsung heroes involved in our pandemic response that in some cases I've not had a chance to previously publicly acknowledge. To our colleagues and friends in the media, thank you for your fantastic support and ongoing professional and comprehensive coverage of COVID-19 and P.E.I. We could not do this without you. To my team and our many partners across government and in the community, you have worked tirelessly in support of our collective effort. To our healthcare workers in P.E.I., thank you for your caring, hard work, dedication, and teamwork. To date, we have been able to meet every challenge presented to us by COVID-19, and on behalf of all Islanders, thank you. To the many other essential workers in P.E.I., including truck drivers, grocery store workers, retail staff, restaurant workers, farmers, fishers, taxi and bus drivers, police officers, teachers, firefighters, plumbers, early childhood educators, hairstylists, clergy, maintenance staff, commissionaires, electricians, and construction workers, just to name a few, and there's so many more. Thank you for doing your part to keep Islanders safe and for continuing to show up for work and ready to serve in the midst of a global pandemic. To the families of healthcare workers and essential workers, we owe you a huge thank you, and this would include my own family. While your loved ones have been working long hours protecting Islanders during the past 9 months, you were shouldering more responsibility at home. Thank you for doing your part to support the provincial pandemic response. To our seniors, especially those living in long-term care and community care facilities and their families, we know that COVID-19 has been very challenging for you, limiting your opportunity for socialization and interfering with your regular visitors and outings. Thank you for being so understanding of our need to protect you from COVID-19. To all the children and young people in P.E.I., thank you for your leadership and teaching us so much about how to adapt to situations quickly, including wearing masks. And to the thousands of young people aged 20 to 29 who showed up to be tested a few weeks ago, thank you for listening, and thank you for caring about yourselves and your communities. Your behavior reconfirmed that the future of our province is in good hands. And to all Islanders, from tip to tip, thank you for your unwavering support, patience, and resilience. While we have more work ahead of us in our fight against COVID-19, I am confident that each of us will continue to do our part and stick together by staying apart. I've never been more proud to be in P.E.I. than I have been in 2020. We all love this place, our home. As we look ahead to 2021, we can be optimistic knowing that we will have access to COVID-19 vaccines. We are much better prepared to deal with this pandemic now than we were in March of last year when the pandemic began. We have developed strong and effective partnerships to support our public health response to COVID-19. Since declaring a state of public health emergency in the middle of March, our provincial public health system team has been supplemented by hundreds of dedicated and hardworking individuals. We would not be where we are today without your support, expertise, and collaboration. And I know you know who you are, and thank you. So as Marion said, we have lots to be grateful for. And as we look forward to staying closer to home and celebrating this holiday season safely with a small, consistent group, please be careful, be cautious, and please be patient, and please be kind. Thank you, and happy holidays. And we'll open it up for questions.
Steve Bruce, CBC.
Yes, hello to you both. First question is for Mrs. Kloss or Dr. Kloss, not Dr. Kloss, not sure what to call you exactly. Do you mind just clarifying the rules around self-isolating right now? In all circumstances, does everyone in the household need to self-isolate, or does it depend on the layout of the house?
Hi, thank you. And I think it's important to clarify a couple of things around self-isolation. So it's if you choose to self-isolate with other members of your family, and that should be a real discussion with the other people in the family, you all need to stay in that house or on the property, and that is really important. No one intentionally wants to spread COVID, but we know there's a certain group of asymptomatic people who can transmit the virus. So those people in the house need to self-isolate. There have been occasions where if someone is able to separate in a house and self-isolate, they are able to do so. And that may mean they're in a separate section of the house. They have their own washroom, that they do not share a kitchen, and they are able to do that because they're in a basement or a different section of the house. There are times when that is possible. But I do want to also mention, and I think this is important, that we have some indication there may be some family members coming here and for maybe 3 or 4 days over the holidays and choosing to isolate with family. If they leave after 3 or 4 days, the family that is still here needs to start self-isolating for a period of 14 days. And that means that it will extend that period of time they're in isolation and that they need support. And that is because we do not know if someone leaves, if they may have unintentionally transmitted virus. So that is something that we'd like to mention because we've had some questions about it.
And you mentioned in your briefing that some border officials doing the screening have had some unkind interactions. Can you elaborate on that a bit? I mean, what have they been up against in the lead up to Christmas?
Well, I think we certainly understand after months of global pandemic and the challenges around it, we can understand that there are some people who can be frustrated and are tired and anxious themselves. But our screeners are doing a job that has been very important in our pandemic response, and it has helped us get to the position we're in this province at this time. And they have sometimes been met with some of the frustrations, and I don't feel like anyone should be treated that way at our border entries. And certainly it is not something I like hearing about from our staff and our screeners. And it's so we are asking, as we always do, for patience and kindness as people are coming across the border, whether it's at the bridge or at the airport.
Okay, thanks so much, and Merry Christmas to you both.
Yeah, Merry Christmas.
Dave Stewart, The Guardian.
Good afternoon, ladies. I guess just a bit of a recap question here. I think Dr. Morrison had mentioned it during the briefing. Last week you had 1,950 vaccines. I think you said that 1,500 of them, 1,500 people have received the vaccination. And just recap exactly, you have the vaccines, the remainder, the remainder, and how long is it going to take to hand those 1,950 out?
Great. I'm glad we're able to recap that. So the 1,950 doses did come into the province last week, and I think scheduling the appointments and actually giving the vaccine has taken, in some of the clinics, has taken a little bit longer than we initially anticipated. And so by the end of the day today, we're hoping approximately 1,500 will be done, and they've added 2 more clinics at the end of next week. And it's really just trying to schedule people in that when they're not working and when they're available. So I think that's continuing. The second dose has arrived in the province. So that's I know we had questions last week about that. The second dose has arrived. And then we will start having regular small shipments of the Pfizer vaccine throughout January, and anticipate the Moderna, if it's approved, may arrive in the province the last couple of days of December or early January. Again, we haven't received a confirmation of a date, but it is anticipated.
I guess my follow-up question, that you just mentioned the Moderna there. Do we know how many doses we're getting with that Moderna shipment, and roughly when? You said around the end of December, early January?
So we have some numbers for planning purposes, and we'll be able to do a few hundred people with those initial Moderna doses. But until I get confirmation, I don't really know for sure, but we're just still waiting. I think the Moderna product should get approved in Canada this week, and then that will help us confirm shipment dates and confirm shipment amounts, and we'll be really pleased to start getting that out as soon as we can into long-term care facilities.
Thank you, and a Merry
Welcome.
Christmas and a Happy New Year to you both, and love the festive outfit.
Thanks.
Natasha Pace, CTV.
Thank you. I know you touched on this a bit in your opening remarks, but I wanted to check in and see what the plan is for holiday testing for COVID. Could you recap a bit what Prince Edward Island is doing to test people for the COVID-19 virus over the holiday season?
Well, maybe I'll start and then I'll turn it over. So, I mean, our testing, it is really important that people with any symptoms continue to get tested. We also continue to book in appointments for testing that are needed for some of our rotational workers, for instance. But there are going to be, let Marion speak to the hours of the clinics at Health P.E.I. over the holiday.
Yeah, so our clinics will continue to run every day with their regular times in Charlottetown and Summerside. So we will have available testing sites in all of the centers, and it is updated, and I know a news release will go out again later today just to make sure the dates are clear for everyone, with the exception of Christmas Day and New Year's Day. Those 2 days, our drop-in testing centers will be closed, but there is available access to testing, and I was just reminding Islanders today to contact 811. And as Dr. Morrison mentioned, we do have people scheduled in to receive their regular tests according to their schedule for testing with rotational workers and those folks who need to be tested as well. So there's really just 2 days where our regular drop-in is closed, but we do have the ability to test people if it's necessary on those 2 days.
Just on testing, I might just add, because I didn't mention it earlier, P.E.I. has conducted 74,610 COVID-19 tests, and that includes 4,279 in the last week. And I guess that's a lot of tests when you think we didn't do very many in the beginning, so.
So yeah, really encouraging people to plan ahead for their testing. If you have symptoms, as Dr. Morrison mentioned, it is really important to be tested, and the testing sites will be available, so please look online. We'll be confirming the hours are accurate online and that people come and drop in and be tested while we're open.
Thank you. I also wanted to ask about testing at airports. Is there any consideration in P.E.I. being giving out rapid testing at the airport there?
At this point in time, our PCR-based tests are certainly more sensitive and specific, and although we know that that has been discussed nationally, it is not something that we are planning to do at this point in time, but we'll always be open to having that discussion as we go forward. The testing that would be done at the airport would not be a confirmatory test, and at this point in time would not change anything in terms of your isolation requirements coming into this province.
Thank you.
Yeah.
Rachel Collier, Eastern Graphic.
Hi. I guess I'm just wondering if there will be any changes with Operation Isolation over the next week or so, or during Christmas Eve or Christmas Day. Will people still be calling and making checks on those days?
Yes, they will continue to make calls right over the holiday season, including Christmas Day. Yes.
Okay. And I guess you also mentioned that scheduling is taking a little bit longer than anticipated for some long-term care workers to get their vaccine. I'm just wondering, is there any worry of these vaccines expiring? I don't know how that works.
No, I think the vaccines that need to be kept frozen are kept frozen until they're then they unfreeze and then they're diluted and given. So no, it's we're not worried about that part.
Okay. And I guess
Gabriel Drummond, Radio Canada.
Bonjour à vous deux. Ma question, c'est pour la docteure Heather Morrison en français. Docteur Morrison, je sais que vous avez déjà parlé de ce sujet en anglais, mais j'aimerais que vous me parliez en français. On sait que chaque maison va pouvoir accueillir jusqu'à 10 personnes de plus lors des rassemblements pendant des fêtes ici à Lille. Alors, est-ce que les forces d'ordre vont pouvoir faire un travail de surveillance durant les fêtes pour s'assurer que les gens respectent les consignes concernant les rassemblements?
Je sais que nos partenaires vont continuer de répondre si on a les complaintes, si quelqu'un nous appelle sur le 1-800 nombre, et puis si on reçoit quelqu'un qui ne... Si on prend... si on sait que quelqu'un se rassemble dans les plus grands nombres, on va faire les checks et puis ça va continuer partout pendant les vacances. Je sais, j'apprécie beaucoup nos partenaires en renforcement parce qu'ils nous supportent et puis ça va continuer pour les rassemblements et pour aussi les personnes qui doivent isoler, alors tous les deux.
Parfait. Alors, ma deuxième question, c'est par rapport à ce que vous avez mentionné que pendant des interventions des forces de l'ordre dans ces derniers jours, il y a eu des contraintes, peut-être des gens qui étaient mécontents avec les forces de l'ordre. Est-ce que vous pouvez nous parler davantage de ce sujet en français?
Oui, c'était plutôt juste un avis vraiment aux visiteurs et les insulaires qui viennent de retourner à l'île du Prince-Édouard. Quand ils demandent les questions aux entrées, portes d'entrée, il faut être quand même, essayer d'être gentil, poli. Les personnes qui travaillent là font leur job, ils font depuis les mois et ils nous aident à rester en sécurité vraiment ici à l'île du Prince-Édouard parce qu'ils nous aident avec la réponse de COVID-19 ici. Alors, Je sais qu'il y a des personnes qui sont anxieuses et puis c'est 9-10 mois dans la pandémie, mais on devrait quand même traiter les autres avec respect et ça, c'est qu'est-ce qu'on demande.
OK, parfait. Merci beaucoup et joyeuses fêtes à tout le monde.
Joyeux Noël. And I think that's it for today. Happy holidays, Merry Christmas, and hopefully I speak again to you in 2021.